Hello everybody, my name is Hettige Sandagomi and I am a second year medical student. In this video, I am hoping to give you an introduction to the thorax. So these are the learning outcomes that I hope to cover from this video, which I also think runs in parallel with your ILOs as well. Starting off with the areas of the thorax, the mediastinum is the central compartment of the thoracic cavity, and it's located between the two pleural sacs. It also contains most of your thoracic organs. There's two mediastinum. You have your superior mediastinum and you have your inferior mediastinum. The inferior mediastinum is further divided into your anterior mediastinum, middle mediastinum, and your posterior mediastinum, which all lie between the sternal angle and the diaphragm. First of all, we have our superior mediastinum, which is in the area of the thorax above the sternal angle, so round about the T4 level and between the thoracic aperture. Some contents of this superior mediastinum would be the aortic arch, the superior vena cava, the trachea, and the vagus nerve. The anterior mediastinum lies in front of the middle mediastinum, and it contains no major structures. The middle mediastinum sits behind the anterior mediastinum and in front of the posterior mediastinum. It basically contains the heart as well as the origins of its vessels. Also, an important fact to note about in terms of the middle mediastinum is that the trachea bifurcates in here to form the right and the left main bronchi. The posterior mediastinum contains the thoracic aorta, the esophagus, the thoracic duct, the azygous system of the veins, as well as the sympathetic trunks. Now, the bones of the thorax are your sternum, the 12 pairs of ribs which makes up your rib cage, and the thoracic vertebrae. So connecting the upper 10 pairs of the ribs are also to the sternum are known as the costal cartilages. The sternum is a flat bone located at the anterior aspect of the thorax. It lies in the midline of the chest and has a T shape. The sternum can be divided into three parts. So the manubrium, which is in here, then the sternal body, and your xiphoid process. Also, as you guys might already know, in children, these three parts are joined by cartilages. However, as they progress to adulthood, the cartilages ossifies. The sternum protects the internal thoracic viscera, which is its function, so such as your heart, lungs, and esophagus. In terms of the rib cage, from the first rib to the third, the thorax widens in the shape of a dome to about 2/3 of its full width. Then from the third rib to the seventh rib, the thorax widens a little further. Now, you could see it from this diagram clearly. And then, so it widens a little further in the shape of a cone. And then from the seventh rib to the 12th rib, the thorax narrows slightly and the ribs become very much shorter, which can be seen in here. So your ribs are shorter. As part of the thorax, the ribs are meant to protect the internal thoracic organs. However, it also has another role. It helps move the chest during expansion to enable the lung to inflate. The thoracic spine is the second segment of the vertebral column, and it's located between the cervical and the lumbar vertebrae. It has 12 vertebrae and is separated by the intervertebral disc. In addition to that, it also forms part of the thoracic cage, which helps protect the internal viscera again. The joints of the thorax include your xiphisternal joints, which is between your xiphoid process and the body of the sternum. Then you have your intervertebral joints, which is between the vertebrae. Then you have your sternochondroral joints. Now, the sternochondroral joints is also referred to as your sternocostal joints. And these joints are formed between the lateral borders of the sternum and the costal cartilages of the first to the seventh ribs, and sometimes the eighth rib as well. You then have your sternoclavicular joints, which is between the manubrium and the clavicles. Then you have your manubriosternal joints, which is between the manubrium and the body of the sternum. Then you have the costochondral joints. Now, the costochondral joints are the articulations between each rib and its costal cartilages. So it's a hyaline cartilaginous type of joint. You also have your costovertebral joints, which is formed by the ribs of the body of the vertebrae, and the intercondylar joints. The intercondylar joints are plain synovial joints between the adjacent borders of the sixth, seventh, and the eighth and the ninth costal cartilages. Now, some of the muscles in the thorax include the diaphragm, the intercostal muscles, which is made up from external, internal, and the innermost intercostal muscles. Then you have your transversus thoracics muscles and the subcostal muscles. So the diaphragm is a double domed musculotendinous sheath located at the inferior-most aspect of the ribcage, and it separates the thoracic and the abdominal cavities from each other by closing the inferior thoracic aperture. Since one function of the diaphragm is to provide passageways for structures from the thorax to the abdomen, its surface has several openings, which you can see here clearly. So these openings include like the caval openings for your vena cava foramen, the esophageal hiatus, and the aortic hiatus. The diaphragm is one of the main muscles for respiration. So when the muscle fibers contract, the diaphragm is flattened. This increases the volume of the thoracic cavity vertically, which decreases intrapulmonary pressure, and it allows the air to enter the lungs then. And when the diaphragm relaxes, the thoracic volume decreases and your intrapulmonary pressure increases, and hence it allows air to flow out of the lungs. So you have your intercostal muscles. Starting off with the external intercostal muscles, they are the most superficial set of muscles that occupy the 11 intercostal spaces. These muscles elevate the ribs during forced inspiration, and this increases the transverse and the anterior posterior diameter of the lungs, which in turn decreases the intrapleural pressure. So this process expands the lungs and facilitates the entry of the air into them. The internal intercostals are also part of the muscles of the thoracic wall located in the intercostal spaces between the ribs. It comprises the middle layer of the intercostal muscle group. Being located in the intercostal spaces, they share a common function with other muscles that occupy this space, namely the internal and the innermost intercostal muscles. So the internal intercostal muscles are accessory respiratory muscles. So together with the innermost intercostals, they enable forced expiration by depressing the ribs, thus shrinking the diameter of the thoracic cavity and pushing the air out of the lungs. Something to note is that the external intercostal muscles actually do the opposite of this function. The innermost intercostal it comprises the third and the deepest layer of the intercostal muscles, and they are located deep into the internal and external intercostals, filling the 11 intercostal spaces between the ribs together with other intercostal muscles. And these muscles usually are responsible in depressing the ribs and aiding to push the air out of the lungs during forced expiration. So the transversus thoracics, which you could actually see in here, it's these muscles in here. So it's a muscle found in the inner surface of the anterior chest wall, and it belongs to the intrinsic muscles of the chest wall. The transversus thoracics is an accessory respiratory muscle that is active during forced expiration. It pulls ribs 2 to 6 towards the sternum during forced expiration, which results in the depression of those ribs. And also besides this, the transversus thoracic stiffens the thoracic wall during inspiration, which then in turn prevents paradoxial movements of the chest wall. Then you have your subcostal muscles, which you can see over here. And these are thin muscles found in the inner surface of the posterior thoracic wall, bridging 2 or 3 intercostal spaces. The subcostal muscles belong to the accessory respiratory musculature again, as their function is to basically depress the ribs during forced exhalation. This action then enables them to pull the ribs towards the central axis of the thorax, which then compresses the lungs, pushing the air out of them. Now, moving on to the neurovasculature of the thorax, this table gives you a note of some of the main nerves and blood vessels in the thorax. So the intercostal nerves are the somatic nerves that arise from the anterior division of the thoracic spinal nerves. So that's from T1 to T12, T1 to T11. These nerves, in addition to supplying the thoracic wall, also supply the pleura and the peritoneum. In the thorax, you also have the vagus nerve, which is the main parasympathetic outflow to the heart. Then you also have your phrenic nerve, which is bilateral, and it's a mixed nerve that originates from the cervical nerves in the neck and descends through the thorax to innervate the diaphragm. So it's the only source of motor innervation to the diaphragm, and therefore it plays a really crucial role in breathing. Then you have your anterior intercostal arteries, which are paired with intercostal arteries that supply the anterior aspect of the intercostal spaces. The posterior intercostal arteries are arteries that supply blood to the intercostal spaces in the posterior aspect. And there are 11 posterior intercostal arteries on each side. The internal thoracic artery is a long paired vessel, and it originates from the proximal part of the subclavian artery. It runs inferomedially and enters the thoracic cage deep into the clavicle and the first rib, and it then terminates at the level of the sixth rib. The subcostal arteries are bilateral small arteries that arises of the distal descending thoracic aorta, which courses laterally beneath the 12th rib. The posterior intercostal vein, what's important to know about it is that it drains into the right side, so the azygous and the hemiazygous and accessory hemiazygous veins. And the anterior intercostal veins, they originate from the intercostal space just inferior to the anterior aspects of their respective ribs, and then drain into the internal thoracic and the musculophrenic veins. And finally, you have your internal thoracic vein, which arises from the superior epigastric vein and drains into the brachiocephalic veins. So there are 3 compartments of the thorax, namely your mediastinum and your 2 pulmonary cavities. The mediastinum is the compartment that takes up the middle portion of the thoracic cavity. It's lined by the mediastinal pleura, and it extends into the inner border of the sternum anteriorly. The inner border of the thoracic vertebral body is posteriorly and spans the full vertical length of the thoracic cavity. It has different regions. So the superior mediastinum and the inferior mediastinum. So those are the areas that we spoke about in the very first slide. Then you have your pulmonary cavity. So 2 pleural cavities house the lungs, 1 on each side of the mediastinum. Each lung is covered by a pleural sac, which is made out of 2 layers of pleura. So that's your visceral pleura, which adheres to the lungs, and your parietal pleura, which lines the cavities and is attached to the thoracic wall, the mediastinum, and the diaphragm. So you could see those pleura in here, in this diagram. Also, something to note is that each cavity contains recess spaces, so called your costodiaphragmatic and your costomediastinal recesses, and that allows room for expansion of the lungs during inspiration, but I'll be speaking more about this later on. So for the anatomy of the pleura, now the pleura basically refers to the serous membrane that lines the lungs and the thoracic cavity. There are 2 pleura in the body. One is associated with each lung, and they contain a serous membrane. So the serous membrane is a layer of mesothelium which is supported by connective tissue. As mentioned in the slide before, there are 2 types of pleura. The parietal pleura covers the internal surface of the thoracic cavity, and it is thicker than the visceral pleura. The visceral pleura covers the outer surface of the lungs, and it extends into the interlobular fissures. It's continuous with the parietal pleura at the hilum of each lung. The pleural cavity is the potential space between the 2 pleura. So the 2 pleura as in your visceral and your parietal pleura of the lungs. So I slightly spoke about these recesses in the slide about the compartments. In some areas of the thorax, the lung does not completely occupy the pleural cavity. This is especially true for the inferior region of the pleural cavity, where the inferior margin of the parietal pleura actually extends approximately 2 ribs inferior to your lungs. So there's 2 pleural recesses, as mentioned before. You have your costodiaphragmatic recess. Now that's the largest out of the 2, and it's located between the costal and your diaphragmatic pleura of right and left pleural cavities. They occur at the costal reflection, where the costal pleura becomes continuous with the diaphragmatic pleura. Then you have the costomediastinal recess, which is the smallest, and it's found anterior at the sternal reflection, where the costal pleura is in contact with the mediastinal pleura. It is also important to note that this recess is larger on the left side, and that's because of the presence of the cardiac notch in the left lung. Now, as mentioned previously, the pleural recesses are there to provide additional space for the lungs to expand during a forced inspiration. However, they can also be a potential site for fluid accumulation. And from here, this fluid can sometimes be aspirated. When this happens, so when there is accumulation of fluid in the pleural cavity, it's called pleural effusion. Now, thoracentesis is done during moments of pleural effusion. So one of them, this is when, so this procedure is basically when a needle is inserted into the pleural space between the lungs and the chest wall, and it may be it also could be done to determine the cause of the pleural effusion. I won't go too much into detail of thoracentesis, mainly because I don't actually remember how much you guys have to know, but just know that it is a procedure that is done in order to get rid of the fluid that's filled in the pleural space between the lungs and the chest wall. So that's it from me, and I hope you found this helpful. If you do have any questions, please feel free to email me to the email address that's shown in here. As you guys may already know, GUCAS will also be providing more helpful tutorials via our YouTube channel. So please do make sure that you don't miss it. And thank you very much.